Good morning, everyone. Might still have one or two more people, excuse me, joining us, but we can go ahead and get started. Hope everybody's Friday is off to a good start. So we have about 50 minutes this morning, and we'll just pick up where we left off last month. As a reminder, we had several people from KCSL came in and talked about ongoing early childhood initiatives that are related to family navigations. We talked about the family resource centers, 1-800-CHILDREN, and then Help Me Grow. And it seemed like the group was particularly interested in exploring connections with 1-800-CHILDREN and what this group might do to help leverage the work that's already going on and really make sure that people are making connections and aware of that resource. I think both locally in their communities and just ensuring that it's really being utilized and shared statewide. So I know it's been a while since we last met, but I'm going to open the floor and see if anybody has either any further thoughts from our conversation last time. I think it kind of went down to the wire and we had to wrap up pretty quickly, or just anything that you've been thinking about related to family navigation over the past few weeks.
This is Dana, and I'll say that I did mention 1-800-CHILDREN to even my agency, and I don't think they're fully educated about it. And so I'm hoping that we can have someone come and do just a quick presentation or a Zoom. The message that I got was, well, it's not updated, but when I said, but you can update it yourself, that's what I love about it, is that, you can check in your community. So they want us to really push it to parents. They said it's okay to share with parents. Go ahead and do that. And then I think in July, somebody's going to Zoom in and do a presentation for our local ICC. So hopefully just getting the word out will be helpful and making sure that people understand, yeah, it's always going to be growing, but the thing I love about it is you can add people if you need to as resources become available.
That's great, Dana. Thank you for sharing that. That sounds like a really positive, schedule a Zoom and just make sure people are aware of it. It's a great resource. Anybody else? Okay, well, again, we left with a pretty robust conversation last time, so I think we can continue thinking about, are there things that you feel like this group can do related to 1-800-CHILDREN or other things related to family navigation? And that could be some sort of formal recommendation. It could be just continuing to ensure that there are connections and people are aware. I think, Dana, you provided a great example of one of the roles of the panel members is making sure that people in your community and your partners are aware of the work that's going on within the system. And so I think taking it back and just finding ways to ensure that that's happening is also a great outcome of this group. Does anybody have thoughts on there's not necessarily a timeline on what this group wants to focus on. It's really what you feel like is the most impactful work. So any thoughts on kind of where you'd like to focus the conversation today and moving forward?
I guess this would be a question for KCSL, but I've noticed just on TV the commercials running for the shortage of childcare. And I'm wondering, did KCSL do like anything, a media blast or anything with TV or anything with 1-800-CHILDREN, or do they plan to help get the word out?
That is a very good question. I know Gail is on vacation today. I don't know if anybody else can answer that. I am not able to answer that.
And I'd be happy just to shoot Gail an email and ask her, because I'm just curious. Like I said, I've noticed the childcare need commercials on, and I think it would be great to have that as well, the 1-800-Children as well, for parents to see on TV or radio or wherever.
Okay, well, I'm gonna share screen again and go back to our Jamboard, which is where we left off last time, and see if maybe that might spark some ideas for what we want to discuss today. Let me I'll put a link to this in the chat again real quick. So last time there was a lot of conversation around libraries and other community settings. I think healthcare providers has come up several times, kind of places in the community that making sure there are like posters up or cards that people could have for 1-800-Children's, potentially have some opportunities for presentations, things like that, to just really ensure that that awareness is there and that that information is reaching parents. We also talked about the section here in the middle. I believe it was Natalie. I think you had shared the language that KSDE uses as kind of a requirement for people being funded to list their programs in 1-800-Children. So I think more conversation around that could be another direction of how are we making sure that people, that partners across the system are not only aware of, but have their information in 1-800-Children and are again passing that information along to families.
Yeah, I know when you have a baby, you're like bombarded with all this information that you come home with the hospital, but that might be something that to add if they haven't already into like the new baby packets, or even, you know, really reaching out to the social workers in the hospitals as well. Yeah, so I'm not sure that they know it even exists.
This is Lisa Schmidt. In Leavenworth County, the Tiny K grant organizes, they ask for funding from a local group called the Child Abuse Prevention Council about every 2 years, and they print a brochure and they put this kind of resources in a trifold brochure, and those are distributed across the county because it includes everything from the school districts, Part C programs, to the library, to, in Leavenworth County, we have something called the Guidance Center, which is mental health programs, Head Start, anything devoted to the under 5 age group is included in this brochure. A lot of counties don't have that, but that would be a format we would use it in.
That's great, Lisa. Do you feel like it sounds like that could be a really good model for other places? Oh, you're muted.
Sorry.
You're fine.
It takes some organization, and Leavenworth County's brochure started way back in the day of the Kane grant, of the mental health grant. So it's been moved and modified and tweaked and redone, and it's redone about every 18 months to 2 years. We have them reprinted. I have I'm not the person in charge of it, but this is what it looks like. If anybody can see it.
Do you know if it's available electronically at all?
I believe it is. I can email it to you.
That'd be fantastic. Yeah, it sounds like that could be a great model.
If I don't have it, I know who does. So
Okay. If not, don't worry about it, but I was just curious.
no, I know the Tiny K director has it for Leavenworth County.
Yeah. Yeah, I think certainly if there are areas that it feels like information is getting out to community partners and to families really well, then absolutely let's think about how we can scale that model.
Well, and Leavenworth County attempts to contact physicians, and I mean, they're trying to touch all of the folks that see the Birth to 5 group.
Do you know, are there connections in Leavenworth with like hospitals and or healthcare providers or libraries, or can you talk about who all is getting those packets?
There are connections with the doctor's offices, the hospital. The school districts use it more. They try and provide this brochure to providers, childcare providers in the county, and there are connections out there, but it's been a long process and they've done it for years. I mean, this is about 10 years old, every bit of.
And Lisa, that brought up a thought that I had too. You know, we always try to think, where are the kids? And even though they're above, 5, school districts are a good resource to use, because a lot of those kids might have little brothers or sisters too. And 1-800-Children's appropriate for even school-aged kids. So maybe some connections with the school districts would be an idea too.
Well, and that comes back to getting the information out to the families.
Natalie, I'm sorry to put you on the spot, but I'm wondering if you can talk. Do you know how? Do you like? Can you respond to that?
Yep, I was just getting off mute to say
Okay,
something.
perfect.
So if they have a preschool program that is funded by us, by KFCE, then they are required to not only put their information in 1-800-Children, but also to be distributing that information to families. That requirement goes to the preschool programs, but usually there's a principal or a superintendent overlooking that. So I don't have any guarantees that it's going to the older kids. I know it's going to the younger kids. I've had a couple principals say, oh my gosh, this is such a cool resource. Like, why didn't I know about this? So I'm hoping that they're sharing it with more than just their preschool, but we can definitely encourage them to share it with more than just the preschool families.
This is Esther. I'm with Lawrence Public Schools. And when you say that, yeah, we have that, but I don't know that we share that very well. It might be worth an effort to just send to the communications directors or whoever else who does that for districts. Just did you know about this? And then they could include that on their district Facebook page. And in their district employee. We have, for example, Lawrence, we have a daily post. So that would be something that would be appropriate for a daily post. Like, did you know about this? That could reach quite a few people, employees, families. But I think the Facebook page, if there was something to just post, that would be fantastic, because here in Lawrence, and we're not a huge district, but we'd be able to post it on our district Facebook page as well as our early childhood Facebook page.
I think that's a great idea, Esther. And a lot of the times school districts will, like, we get all our paperwork in when it's due. And we're like, okay, yeah, I need to remember that for next year. And then by the time next year rolls around, it's kind of out of sight, out of mind. So I think that's a great idea for maybe for us at KSTE to send out a reminder, be sure that you're sharing that information with families. And that's a great idea to put on Facebook, because, you know, I feel like that's a place that a lot of families are a lot of the time, or social media of some kind. And I'm wondering if just through KSDE, if we just put up on our site a little blurb about 1-800-CHILDREN too, or on our Twitter page or whatever.
Yeah, like if
that's a
I
great
saw
idea.
something on your Facebook that then I could share, then we would have that consistency with the logo on it and everything. And maybe, like you said, people forget, we get busy, we don't do it. If that's just so readily available and you can't miss it, even I would get that posted. Thanks, Natalie.
Thank you.
Callie also mentioned in the chat that it could be shared with parents and teachers. So I think that could, I mean, that's a great, relatively low cost and easy way to get the word out promptly.
I mean, really, excuse me, this could be a message to the entire panel, you know, to share with the agencies they represent. And, you know, that's a real easy win for any of us to, you know, for me to have the Family Conservancy promote that post. And it would probably also have those social media, you know, marketing professionals be more on the lookout for additional posts and information in that way.
So I'm wondering if we need to ask 1-800-CHILDREN if they have like that consistent message that we can share across the whole entire panel. That could be like a little blurb or a logo or something that we can all share across the panel. I think that's a great idea, but maybe it should come from 1-800-CHILDREN.
Can certainly ask that question of Gail and her team. I almost wonder if it could be like everybody agrees on a certain week to really start promoting it, so that it's just like the message goes out in a really aligned way across the system.
I think that's smart.
What do you think about timing for something like that? Do you think like summer or back to, like, kind of as people are gearing up for back to school time? Is there, it's probably not a perfect time for everybody, but
I think back to school is great.
Yeah, I don't think we'd want to do it during the summer if we're wanting to hit school-aged families. Although summer can be like the most stressful for some, that they may be needing it during summertime.
maybe that last couple weeks where people are so excited for school to be back in session. That's a great point, Mallory, in the chat, sharing with District Early Childhood to share on their technology platforms like ClassTag and Remind. Absolutely. I think, yeah, childcare providers as well. I know many of them have systems to communicate with their families and yeah, figuring out, is there a way that people could use social media, but whatever platform that they're already using. Any other thoughts about how else 1-800-Children could be promoted, either with this idea or other opportunities? I don't want to overcommit KCSL. I think there would need to be a conversation about capacity, but I also think about the offering, and Dana, you clearly took them up on this, to have more presentations with community partners and just make sure that information is available. So I wonder if there could be, I know they've shared on like the biweekly All In for Kansas Kids new webinars, but also just kind of like maybe there could be additional opportunities as just, hey, it's a reminder that this resource is here. Like that.
What has been done for 211 with the United Way, just plugging that in as a resource? I know that they are similar. 211 is probably not as updated frequently, since that has to be done by each agency or program. But I think if it could be broadly just pasted onto 211, as this is a go-to for anything with children.
That's a great question. I know, and if anybody does everybody know what 211 is? It's United Ways. It's kind of like it's a national thing, but it's like their community service. I'm not saying this very well. It's like their resource list, but it could include early childhood, but it includes a lot of different resources. And I know it's, I think, more utilized in certain areas. And feel free, that was not a very good explanation, so feel free, anybody who also wants to jump in with that. But I know that there have been conversations with them, but I don't know, I don't want to give you incorrect information about the status of that, but I think that's a really good question. And I think also if there are other local resource lists or, just making sure that there are appropriate connections with where people are finding information in their communities.
I would say that 211 is the 1-800-Children for like a broader list of needs, like paying rent and accessing food. And so anything that a person or family might need, it has an exhaustive list of resources in the area that a person could access.
Thank you, Crystal. That was a much better explanation.
Is it a website?
Yes, it's a website and a phone call. Okay. I would also say that would be another, if they were looking at public presentation places, to do that to local United Ways. Because often what happens if the resource isn't listed on 211, it goes to small United Ways, it's going to be directed to one of their board members, who is going to be pretty lost in trying to navigate what those resources are too. But if they had this as an option of, we can just call 1-800-Children and they can help us.
Yeah, that's a great point. I think of looking at who are, I think 1-800-Children has been shared quite widely within the early childhood world, but who are the people that aren't in those spaces, but certainly having conversations with families and how can we help connect them to early childhood. Any other thoughts related to 1-800-Children? Or any other ideas that we want to talk about just more broadly with family navigation?
I was just thinking in my little town of Ashland, if you want to know something, you go to the post office because that's where all the information is. So I'm going to ask for a poster and have that posted at our post office, and then ask some of our families that we meet within the littler towns too, Mineola, Spearville, to post it, because all those little towns have somewhere where you get your information. And usually it's the post office. So I'll see if I can get some media stuff from KCSL and start passing those out to the small towns.
That's great. I think last time we also talked about making sure that, doctors' offices and their waiting rooms have access to posters. And I think figuring out where are there people that are sitting and waiting, and making sure that there's, there are printed materials available. And so I think that's a great, it's a great way to just make sure the word is out. Okay, well, I feel like that's a lot around 1-800-Children. I'm going to go back to, I know we've got quite a few things on this board, but just go back and see, are there other issues? Family navigation is broad. Are there other things that you've been thinking about that maybe this group could either put a recommendation forth or just explore or find out a little bit more information about what's going on within the system?
I'm curious, but I don't know if someone's in the room to speak to this, but was it, I remember a home visiting presentation. I think it was at a panel meeting. Am I remembering that right? And then they were sort of kicking off their big marketing campaign that had like commercials, and I just wondered just how, like, if that campaign was really effective for them, if they saw like interest go up. But I don't know if there's anyone in here that has any connection to that.
That is being done through the home visiting leadership team as part of a PDG grant. And it's just wrapping up its first year, which was more of the planning stages. They were able to put some materials out, but I don't think that we've seen an impact from it yet, because it's actually ahead of schedule for what the plan was.
Okay.
But right now they were still in the cycle of trying to put the plan together for how they would receive that information back to see if it had an impact. So
Thank
DECA
you.
is the lead agency on that work.
Thanks for that. I was just curious.
But that sounds like when they're ready, that could be a great follow-up presentation to the whole panel.
Yeah, I agree. I think too, maybe even in an interim of being able to give them feedback for what you have seen, and if it was impactful locally, because I don't think that they have built in a way to monitor that yet. The overall goal was to normalize home visiting. And I sit on that home visiting leadership team. I'm happy to take any feedback back to them.
Yeah, Kelly, if you would be willing to just note I think there would be a lot of interest, not only with this group, but excuse me, across the panel. I think whenever they're ready, I think certainly extending an invitation to come share with the group, that'd be great.
Okay, I'll do that.
Thank you. Kelly, I don't want to put you on the spot, but I'm curious, just given your role with that group, is there anything related to home visiting that kind of stands out to you as something that could use additional discussion? I mean, that's obviously a huge resource in terms of how families navigate the system. Do you feel like there's any additional support this group could provide those efforts?
One of the high up there in the tree needs that I don't know that anybody's ever figured out how to navigate is supports for family, friend, and neighbor childcare providers. That is a common thing for children to be placed with a family, friend, or neighbor for childcare needs, and then what supports are in place for that, as far as helping them build a business to become a full childcare, with the foundation being they started doing it for, helping out a family member or friend, or what licensure, what things need to be in place in that. There is a program in the Kansas City area that does home visiting for family, friend, and neighbor providers.
I
think
see
there's a
go
great
ahead.
need to support that group.
I see a resource for them in becoming licensed, but I don't know if the effort to connect the dots has been made. So through Childcare Aware has hired on the childcare health consultants.
Mhm.
And there's that, they added on that level 1, which, you know, helps walk new providers through licensing and provide some startup stipends for them. But as far as, you know, making that, you kind of, I don't know, you connecting the dots for the friend, family, neighbor care is probably not there. We, through my program at the Family Conservancy, we've been in that space of helping providers open, but they pretty much have to have gotten to the health department to do that new provider orientation for us to ever know about them. Like we haven't embedded like a targeted strategy to find those providers who, you know, are not yet licensed.
The Kansas City Parents as Teachers program has a supporting care providers program that does that. Now, the goal is not always to get them licensed, it's to provide quality childcare, because some people don't want to open a business from it. But if they do, that home visitor will help them navigate getting that licensure done. We at our state association have not pushed it too largely because the curriculum and model behind it has not been evaluated. So there's a curriculum for it now that is currently happening right now, and our national office should be launching a pilot this summer that has evidence-based practices behind it. Because I think, especially coming out of COVID, we saw that more of, I've got to go to work, you're going to go to the neighbor's house.
There has been some good work with the quality subgrants through the PDG funding, not necessarily specific to family, friend, and neighbor providers, but there are a few grantees that are working specifically to support currently unlicensed providers, sometimes providers who don't realize that's a problem, to help them become licensed. And so I think there are related efforts that could certainly be looked at for just making sure. I think it's a fairly common thing for people to just not realize there are legal implications for that.
Absolutely. Yeah. And that's a big part of what that program does too, is that, you know, you can only have this kid for so many hours if you're not related to them and so on before you have to go through that process.
I will also just tell you that I'm involved with the childcare systems improvement team, and one of the recommendations, that group is specifically focused on childcare licensing. And one of the recommendations that's being developed now is a toolkit for how to actually go through the licensing process. And so that is, it's being written as we speak, and there will be an opportunity over the hopefully over the summer, over the next few months, for a public comment on that. And it doesn't specifically call out that group, but I just wanted to note there are a lot of efforts going on right now. I think the childcare health consultants that Crystal mentioned, to really just help people connect to the licensing process and make sure that they're feeling supported along the way, that there's a lot of good work going on around that and making sure that it's extending as far as it needs to extend.
I know in the 19 counties of Southwest Kansas, and I don't know enough to speak about it, but we do have a project called Pathways for Family Child Care Providers. And again, I don't know enough to speak about it, but I know they're working on helping people if they want to start up a small business and how to get licensed and all that. I should know more about our programs.
No, that is actually that is being funded by the subgrants through PDG, and yeah, they've done some incredible work. Them and Child Start and several others have really, I think, really do have some great models for how to help people become licensed and just know they're not alone in that process. So I appreciate you highlighting that, because I think that's really been a bright spot in the system the last couple of years. In terms of like the family navigation side, do you feel like there could be more done around families understanding that is, the licensed versus unlicensed, and certainly there are many access and affordability issues related to childcare that I don't want to just set those to the side. Those are real issues, but that families don't always know either that that's not always okay.
I think go ahead. I'm sorry.
You're fine.
I think affordability for families is regardless the number one key. If they do not make enough money to afford quality care and they cannot find a family member and they do not qualify for child care assistance through the state, they don't work, period. And many of them, and I'm just speaking from a provider perspective, if you're working a $12 or $14 an hour job and you don't qualify for child care assistance, you're not sending your child to a quality center, at least, and you're trying to find a neighbor or a friend or a family member to care for your child because you simply cannot afford it.
And that's kind of where I was going, but more along the lines of helping people understand that they likely can qualify for the state assistance. Like, there are definitely barriers, especially when it comes to child support, and that's a really big one. But a lot of families that come to us like, oh, well, I applied for that 2 years ago. Well, they significantly increased the income eligibility from 2 years ago. That, you can be making significantly more than you could have 2 years ago. So when I think about helping families understand, it's that there are options and that home providers can be licensed and be held to similar standards of safety and are likely more affordable. But then there's also these state assistance that is a lot more families are eligible for it than realize it.
I agree with Crystal. The only thing is that I've seen that pendulum swing back in the last 90 days because the center I work in, or I'm the director of, about 20% of our families are on assistance. And if they were on assistance a year ago, their assistance is either being reduced or denied now. And there are a lot of reasons for that, but it is happening.
Another piece I don't know that we can solve, but is parents don't realize how soon they need to be looking at what those options are. And I think if we do educate them as how soon they need to be looking at what their options are, we're going to create a competitive, more competition for those slots. So I understand that's not the answer to the system. That's often something when you're working with families, they'll say, yeah, I'm going back to work next week. And you ask, well, where are you going to childcare? And they're like, I haven't figured that out yet. Like, well, you're not going to work next week because it's not available, especially infant care.
And I think along with this conversation is just the message of early child development. I mean, just, I think understanding how much brain development happens in the first 5 years goes hand in hand with, where you would like to place them. Unfortunately, having federal support of education start at age 5 kind of causes people to think that that's when you start learning, unfortunately. And we've been in this space for however many years, but there was a point in our lives where we learned it too.
And maybe somebody might know the answer to this, but in Southwest Kansas, we have a lot of refugees. We have a lot of people that come to work in the plants that aren't U.S. citizens. And so a lot of times they don't know, they'll just find an abuela or somebody that can watch all the kids. So is there something in the government, especially like with the refugees, that they teach them those? This is the expectation, or these are the laws for your child care? And if not, do we need to do that? I mean, I don't know. Years and years and years ago, like over probably 25 years ago, I know the packing plants had classes for their workers, and I think they required them to take so many hours at the beginning of their employment, and they basically taught them about banking and rental agreements and those kind of things. I don't know if they do that anymore, but that would be a good in for talking about childcare or brain development and those things. If they even do them anymore, I don't know.
Got about 1 more minute before we head to break. Any final thoughts?
think we found a lot of problems. Now we just got to figure out how do we solve them all.
Well, I want to end on a positive note. I think the social media, I think that's a great idea for 1-800-Children. So I think that's an exciting thing to take back to the group. And the good news is we don't need to solve all the problems in one meeting. We'll come back together again next month and pick it up. Crystal is going to share out for us. So Crystal, I want to make sure you feel like you have what you need. But again, thank you for the conversation. And yeah, I'm excited to hear what people think about this kind of all of us sharing 1-800-Children together idea. I think that could be really powerful. So thank you.
Megan, can I throw something in real quick?
Of course.
While we were talking, I just happened to go on my personal Facebook and found something on KCSL and I shared it, but I put a little blurb on it. Please share in Kansas and know that you can change this, and hopefully some of my resources will take it and share it.
Fantastic. Absolutely. I think that's a great thing we can all be doing as we think about how can we do something more collectively as a system. All right. Well, thank you all. Enjoy your break. And then I'll see you back in the main room at 10 after.